What if I were to tell you that 1/25th of 1% of most people who might ever contract the coronavirus would ever die? I'm not talking about 1 out of 25 people. I'm talking about 1/25th of 1%. This is Mike Stenhouse, and welcome to another edition of In The Dugout, where we have video chats normally with other people. But today, as used to be the case when I played pro ball, I would often sit in the dugout and we would chat with friends about life or whatever's going on. Sometimes I'd just sit there alone and think about the game, visualize how I was going to face the pitcher. So today, this is going to be a solo version of Mike Stenhouse in the dugout. And we're going to dig into those numbers. So to do that, I'm going to wear my baseball cap from Harvard University, where I earned a degree in economics, just so my left-wing critics will know that there's maybe a touch of credibility here. And I hope you like our new background that we're experimenting with today. So let's see how that goes. So let's dig into the numbers. But first, the numbers and the fear generated out of our state government, Governor Raimondo and other officials, never seemed warranted to me, just instinctually. So today, for the first time, we're going to dig into those numbers. But before we get there, there's a concept we have to discuss called herd immunity. Now, herd immunity has been pilloried by the left. Herd immunity is simply a condition. It's a condition, not a strategy, where if enough people in a community are immune to a disease, then the disease basically has no place left to go and will soon die out. How you get to herd immunity, that's a legitimate question. And we're going to talk about that. But getting to a state of herd immunity, which includes some people who are naturally resistant to a disease, others who have developed antibodies to the disease after contracting it and recovering, and then still others who will become immunized with a vaccine at some point in the future. But once you get to herd immunity, you've basically killed the disease. So herd immunity is not a bad thing, okay? It's not. It's a necessary condition to get to kill a disease. The governor started all these lockdowns in our state off with what I think was a reasonable goal of saying, okay, we've got to flatten the curve, we got to do mitigation, we got to do social distancing, we got to take all these precautions in order to prepare our healthcare system and ramp up its capacity in case there was a major outbreak. And that was reasonable. And as we predicted, most didn't, that major outbreak never came. Right now, so let me just fumble around a second here and share my screen, where I've done some calculations. All right, so right now in Rhode Island, as you can see, we have a population of about 1,050,000 people. We have about just under 13,000 known cases, which means we have an overall case infection rate, known infections, of 1.22%. We know that right now, or at least as of May 17th, when I recorded this, or the day after, we have about 230 active hospital cases. We had another, 1,100 or so people who were discharged. So a total of 1,330 people who have ever been hospitalized. So that means among all active cases, that 1,330 divided by the 12,795, that's about a 1.8% of all cases ever, or active cases, are hospitalized right now. If you look at all cases, all hospitalizations, including discharges, 10%, 10.39% of all cases, known cases, I should say, because I'm going to talk about that in a minute, were ever hospitalized. Okay. We also had 506 fatalities, very sadly, which means that of known cases, that represents 3.95%. Okay, with me so far? All right, and but across the whole population, the fatality rate is 0.05%. Again, not 5 out of 100, but 5/100ths of 1% among the entire population. Okay, low number, Still not good. We also know from testing and recent reports that there are far more people who have the disease than we ever imagined, or who ever knew it because they just don't have any symptoms or had such mild symptoms they didn't even think about it. Those rates range anywhere from 5% all the way up to 35%. It is suggested that many populations have 35% or maybe less of their population who have already contracted the disease and presumably have the antibodies so that they are immune to it. Let's just be conservative and say that in Rhode Island, which by the way is a very densely populated state, so you might think this antibody rate might be higher. But again, let's go low and assume that 15% of our population has been infected, most of whom never knew it. That means there has been that means there would be 157,500 cases out there. We know of 12,795 of them. So the undiscovered, unknown cases in our state at that 15% rate would be over 144,000 cases out there yet to be discovered, yet to be tested. So no wonder that the daily testing rate goes up. Now, the legitimate question here is when we see increases in testing or in new cases, is that because we're just discovering cases that already existed? Or does it mean that there's community spread going on? And community spread is the key thing we're going to be talking about here, and why the governor fears this so much and why other people fear community spread so much, when actually it's a good thing, as we will demonstrate in getting us towards the good condition of herd immunity. Okay, so 144,000 undiscovered cases out there, we presume. So now if we look at the rates, now if we take those 1,330 hospitalizations you see right here and divide it by now the 157,000 presumed cases out there, now we see that instead of 10% of all cases being ending up in the hospital, now we see it's less than 1% of all cases who end up in the hospital. Same thing, I'm going to jump down a little bit here and look at the fatality rate. Same thing. If we take those 506 fatalities we talked about, instead of it being a 3.95% fatality rate, if we put that against the 157,000, the assumed case fatality rate is less than 1/3 of 1%. Okay, now let's go back to hospitalizations. And this is the real crux of the argument here today. We know that most of our problems are existing in senior care facilities, nursing homes, assisted living facilities. We know that the fatality rate, let's go there first. We know that the fatality rate has been reported in Rhode Island that of all fatalities, 77% have emanated or sourced or began in a nursing home or related facility. Whether they died there or they died in a hospital, doesn't matter, but 77%, okay? So let's stay on the fatalities. So if we now go down to here, if we assume that 77% of all fatalities occurred among senior care homes or started there, that means that only 23% of the fatalities were sourced outside of a nursing home. So that means for non-seniors, people who are not in senior care facilities, of all people who actually contract the disease, okay, not just of the but even if you contract the disease and you don't live in a senior care facility, your chance of dying is just 0.07%. That's actually another way to look at it, is 0.0007. Okay, but 0.07%, that's an extremely low number. Now let's look at hospitalization rates. We don't know. I haven't been able to find the data that tells us exactly what percentage of people in hospitals came from nursing homes. We don't really know that yet. But let's assume it's just a low number. Let's assume it's 20%, okay? So again, if you're not from a nursing home or assisted living facility, and you do contract the disease, your chances of ending up in the hospital, that means you have pretty acute or severe symptoms, again, is about 2/3 of 1%. 2/3 of 1%, 0.68%. All right, so what we're seeing here is that among the general population, the risks are incredibly low, and that almost all of the major problems we're having in our state are coming from the senior citizens in nursing homes. Let's take it one step further. We also know that for even if whether you're in a nursing home or not, that it's those people who get severely sick or die happen to have pre-existing conditions. Some estimates put that number as high as 80% of all serious illnesses come with people with pre-existing conditions. But again, let's be conservative and let's say that just 50% of those not in a nursing home who did end up in a hospital or who may have passed away had a pre-existing condition, okay? So that means for the rest of us, if you are healthy and not living in a nursing home or other senior care facility, and you do contract the disease, you only have 1/3 of 1% chance of ending up in the hospital. Again, when it comes to fatalities, if you're healthy and you're not from a nursing home and you do contract the disease, your chances are 1/25 of 1%, 0.04% of ever dying from this disease. These are the numbers. There's no there's no fudging here. These are the actual numbers, actual calculations. I've triple checked them. I've run them by a lot of people. So what does this mean? So now let's talk about herd immunity. We know we want to get to 50, 67% in order to defeat this disease, and we hope a vaccine comes soon to get us there. But even without that, the risks of continuing to lock down people just don't make any sense. And these harsh restrictions on businesses just don't make any sense. I mean, delaying the spread of this virus among healthy populations, as the governor is planning for most of the summer. I mean, she shut down group activities for the summer, only delays the onset of herd immunity and delays the return to a healthy and prosperous society. I mean, if 99.66 of the healthy population in our state who may contract the disease, if 99.6 of them will never suffer severe health problems, why is our summer been shut down? Why can't we have fun this summer? Why can't we have weddings? Why can't we have fireworks? Why can't we go to ball games? Why can't we have parades? It makes no statistical sense. And for a governor who says she's relying on science and relying on data, these are not data-driven decisions. And I extend the same logic to contact tracing. The governor released an app earlier this week to try to hunt down people who might have come in contact with somebody with the disease, like they were a terrorist or something, or like they were carrying Ebola, a seriously deadly disease. This virus is not that. If 99.66% of the people you track down are not ever going to have a serious health consequence, even if they do catch the disease, why are you going to waste all this time and money on tracking them down? Again, it makes no statistical sense, it makes no medical sense, and it certainly delays the condition of herd immunity, which was what we want. So I got to really question what's going on here with our state and why we are suffering so much economically. We know we're suffering socially. I mean, opioid use is up, suicide hotline calls are up. I've seen reports where stress medications, I forget what you call it, for the time being, are way up. Just people are suffering much more from the economic consequences or from the so-called cure than they are from the disease. So a couple other questions, data-driven questions. Again, if this is such data-driven decisions being made here in our state, the data shows, as we just pointed out, that it is from senior care facilities where most of the problems come from. And by the way, the deaths in our senior care society are twice the national average. That's what the data shows. Why? Who's responsible for that? Why? Why in Rhode Island are so many of our seniors in care facilities dying? Something's going on, and we got to find out. We also know that in many countries, in many states, and as I mentioned earlier, within 30 days, that often the curve has gone down so much that you're almost approaching zero when it comes to serious illnesses or hospitalizations, and maybe even the spread getting down to zero. And again, as we've said, spread is not a bad thing. But yet this governor has canceled in April. She canceled events in June and July, and theoretically, and even suggesting into August, 3-4 months away, 5 months away, 3 or 4 months away. Well, not only does that exceed her legal authority, which only gives her 30 days of executive power, emergency powers at a time, but again, it makes no medical data sense. How can that be a data-driven decision when you have no idea what the data is going to show 30 days from now? And when we've just shown how the data doesn't support lockdowns, how the data supports that if we can get to herd immunity quicker, that will protect vulnerable populations, and the faster we can get back to normal lives, and the faster I can spend quality time with my parents, and the faster kids can spend time with their grandparents. The data also shows that school-age children, K through 12 age children in our state, and I think in every state, have almost zero hospitalizations and certainly zero deaths. Why then do we shut down schools? Why then are we shutting down camps and daycare facilities? Or if we are allowing them to reopen, why are we reopening them with such harsh restrictions when the data doesn't support that? Kids, for whatever reason, up to age 18 just don't seem to be severely impacted by this disease. So again, data-driven, these are not data-driven. These are fear-driven decisions being made by our governor. And this data just shows there's no need for that. The data also shows that certain geographies in our state are having problems when much of the rest of the state is not. In the same way that certain states reopened earlier than others, why can't we allow certain portions of our state to fully reopen before others? If we know where the slight breakouts are or rises in cases are, then why does a one-size-fits-all geographic solution, a harsh solution of that? And by the way, Rhode Island has the second harshest, was judged to have the second harshest lockdown rules of any state in the nation, and that's meant that Rhode Island consumer spending has suffered the biggest decrease of any state in the nation, and yet the data does not support that. So in conclusion, community spread is not to be feared. It needs to be managed. Yes, we have to protect, maybe even quarantine senior populations and other vulnerable people with pre-existing conditions and whatnot. But among healthy people, community spread is actually a good thing. It gets us closer to herd immunity, and herd immunity, statistically, medically, historically, is what can kill a virus like the coronavirus. For In the Dugout, this is Mike Stenhouse. I look forward to our next chat. Dugout chat. Play ball.